In the labour ward, there's so much happening and it can be quite overwhelming. You might be wondering what is going to happen as soon as the baby's born. I'd like to take you through step by step what to expect. Once your baby is born, your doctor or midwife is going to place baby straight onto your chest. And this is the most amazing, life-changing, incredible moment. And this is why we encourage skin to skin. Firstly, so the mom can get to be close to her baby and see him first. And when those eyes lock, it's just love. Babies will be covered in this white sticky vermix. Don't be afraid of that. That is high in protein and protects your baby's skin beautifully. You might see some blood on your baby, nothing to be alarmed about. It's not from the baby, it's from you. And we will simply wipe that off with a towel and you can continue doing skin to skin. While the baby's on your chest, they will be calm, they'll be rooting and looking around and smacking their lips. They will absolutely be in the best place possible to have a good start in life. So if you can ask your doctor or midwife to place the baby on your chest as soon as they're born, you are giving them an incredible beginning. Down below, a lot is going to be going on. Someone is going to give you an injection in your thigh of synthetic oxytocin to help your uterus contract. The midwife or doctor is still going to be talking to you and letting you know we're going to cut the baby's cord shortly. And ideally, when the baby's brought to you, that cord is still attached to the placenta, which is attached to your uterus inside and is pumping oxygenated blood to your baby. We don't want to cut the cord too quickly. We would like to have delayed cord clamping, and that's something you need to discuss with your doctor or midwife. You need to discuss beforehand if your partner is going to cut the cord. And if they are, they can expect it to be quite difficult to do. You actually have to cut 2 or 3 times because those veins and arteries are covered by almost a gelatinous clear substance. And when they're cutting, it can feel quite difficult to get through. They might have to cut 2 or 3 times to cut through the cord. And once that's done, the midwife or doctor is going to say, right, we now need to deliver your placenta. You're not done yet when the baby's out. You will feel a slight tugging down below and you will feel some pressure. And the doctor will ask you to take a deep breath and to actually push. You still need to deliver that placenta and we need to make sure that all the parts of the placenta are there. You will then be asked if you'd like to get rid of the placenta or would you like to keep it. Most people do opt to get rid of it, which means that they will incinerate it or freeze it and send it off later if necessary for testing, if they're worried about anything. The norm would be to get rid of it and get rid of it in the way that they would any medical waste. If you want to take it home, they will put it in a bag for you and let you take it home. If you'd like to encapsulate it and swallow, I've mentioned before, it's still not evidence-based, so that's really up to you. It's not necessarily encouraged at this point in time, mainly because the evidence has not shown it to be beneficial just yet. There's still studies taking place. When you're holding your baby, the doctor will say to you, if he needs to suture, if he or she needs to suture, that they're going to give you a little bit of local anesthetic. And that will feel like a slight burn, just like when you go to the dentist. And once that's been done, they're going to suture you beautifully. Some women will have no tears. Other women might have a 1st-degree tear, which they won't suture. And then still, some will have a 2nd degree and very rarely a 3rd-degree tear where the perineum's torn right through to the anus. The doctor will put their finger into your bum to check that there's no tear going through and that everything's intact there and working well. Don't get a fright if this happens. They're just doing it to see that everything is okay, and occasionally they will ask you if they can put a suppository in, and that suppository is usually an anti-inflammatory. So if you're allergic to anything, you really do need to let your doctor know beforehand, or your midwife. Your baby will then be taken to a little crib to warm up. That crib is almost like a crib next to the bed in the labour ward, and they're going to check and do all their little checks that baby's hips are okay. So they'll often check that the hips aren't out, and they'll do this by lifting them into sort of a froggy position. They're not hurting your baby, just checking that the acetabulum and everything is in place where it should be. They will then do a few checks on the baby's reflexes. You might see your baby make a startle reflex, where it looks like they're getting a fright. This is a very positive sign that the central nervous system is working well and everything is as it should be. They will check the grasp. The babies very often will take your finger and grasp it. And of course, they're going to check the baby's mouth to see that the tongue is working well and that there's no tongue tie. If a baby doesn't feed well and the nipples are very sore, often it would be due to a tongue tie, which is a little bit of skin under the tongue that makes the person speak like this, where the tongue can't move well to get the nipple to the back of the soft palate to feed effectively. And we don't nipple feed, they breastfeed. So that examination of the mouth is really important. We'll check the baby's fontanelles, and this will all be done in front of you. So if you're lying on the bed being sutured or just being checked out or delivering the placenta, the pediatrician will only be called if there's an emergency. If it's a natural birth, the midwife or the nurse in the unit at the time will do that examination, and the pediatrician will do the examination a bit later on the unit, in the ward, or in the neonatal care. They're also checking your baby's head, the fontanelles, to see that everything's normal. Don't be afraid. The baby has these soft spots and they will all close later on. It's to allow the baby's skull and brain to grow. So if you do see a soft spot on the head, it's all perfectly normal. If it's very sunken, that could be a sign of dehydration. And of course, if it's bulging, that could also be a danger sign that will point us towards doing further testing. So your general neonatal tests are all done in the room. Once you've returned back to the ward, most mums will spend about an hour in the labour ward post-birth. So during this time, checking your baby's fine, perhaps latching baby, lots of skin to skin, cleaning you up, maybe offering you a bath. All of that will take place in the labour ward. You will then be brought through to the ward, and on the ward, the nurses will then take over your care and will start coming in regularly to check your bleeding. You can expect some blood loss, but it should not be soaking through your pads and through to the bed. If you have a heavy blood loss, you need to alert the staff immediately. There is a risk that if the uterus doesn't contract well, that it's just sitting there with all that blood pooling, and the risk of hemorrhaging is high. If we're getting a heavy blood loss early on, we need to fix it immediately. And the way that we would fix it is to give you some medication and put up an IV line, and that medication will help the uterus to contract. We will also rub your tummy just below the umbilical button, quite vigorously, if that's the right word. So if someone comes around and checks your pad and wants to massage that area, they're feeling that the uterus is contracted, feels like a ball. And you can actually do that massage yourself when you go to wee, and that will help it to get back into shape. What you might not be expecting is every time you put the baby to the breast, as the baby sucks, there's this oxytocin release, which helps obviously the baby to get the colostrum, and then there's this almost contraction of your uterus, which is happening at the same time. And this is all a way to get your body back into shape and to expel any excess blood. So if you do feel that, it's all normal. You don't need to be afraid. You can also expect to feel perhaps a little bit lightheaded. If you haven't eaten or drank anything, I would encourage you to ask for a nice cup of tea and put a few sugars in, even if you don't usually have sugar, or a nice big glass of cold apple juice. So we want you to be well hydrated, post-birth especially, so that you can feel good to go on to breastfeed. You can also expect that when you go wee for the first time, it might burn slightly. And I have mentioned before that if you carry a little spray bottle to hospital and you put ice cold water in, you can spray while you're weeing, and it will decrease the acidity and you shouldn't have any burning at all. I would also encourage you to ask all moms at your baby shower to bring you a beautiful ice pack for the perineum specifically, because almost 80% of women can have hemorrhoids, which is really varicose veins in the bum. And with all the pushing, you can have swelling and bruising, and the delicate bum, perineum, vaginal area, we want that swelling to go down so you heal quickly. And that's why we'd like you to have an ice pack on that area post-birth as soon as possible, and change them quite regularly, and you'll find you'll have very little pain if you manage that well. The first hour, while you're back in the ward, if you do have pain, it's important to take something for that pain. With breastfeeding moms are often very afraid to take medication. I would rather you take something, have a tiny bit come through, to the baby than not take anything. It's perfectly safe to take a miprodol or an anti-inflammatory ibuprofen based. We perhaps prefer not to have too much codeine because we know that codeine is very constipating. We also know that codeine is contraindicated long term with breastfeeding. It can definitely impact. So if you do take something, it's usually a brufen based medication or Panado paracetamol base. Very safe as long as it's taken at the right intervals. And perhaps feed baby and take the medication afterwards so there's a longer interval in between. We'd also like you to be aware that many moms post-birth might feel very emotional, and to feel emotional is normal, but if you feel that you're tearful all the time or you feel that you just don't want to be near your baby, these are all warning signs that you may need a bit of extra help. In that case, while you're in hospital, you can let your doctor know that you're not quite feeling the happiness that you were expecting to feel. And some moms are just very, very tired, and it's normal not to feel immediate surge. We know that you have all these endorphins, and post-natural birth endorphins are really high, and most of the time you are feeling very high and very happy and really looking forward to feeding and being with your baby. But if you're not feeling that, there's tons of help available. Just let your doctor know so we can sort that out sooner rather than later. And what is quite normal is round about day 2, day 3, when you're about to go home, we get something called baby blues, where the moms do start crying and the partners want to know what they can do. I always let the partner know, if you're not sure what to do, just be there and just say, I'm here. I'm here for you. It's going to be okay, and not to be afraid, because you have that support. Everything will work out. If you're not feeling supported by your partner, let the gynae know that you would like, or the obstetrician know that you would really like to speak to someone, and perhaps have the number of a good postnatal depression support society. There is usually one in every town. Or if there's not a postnatal depression support society, perhaps a good counsellor who specialises in post-birth. The most important person to ask for help when you're in hospital, the most important person that you need to have on your side would be a lactation specialist, and preferably a qualified lactation specialist who is either an internationally board certified or has a certificate of training that shows their experience with working with breastfeeding moms. If you're separated from your baby for any reason, whether it be due to the baby being born prematurely and needs to be kept in the ICU for monitoring, or if you've had a Caesar and the baby's gone to the neonatal high care just to be watched or to get warmer or to get some oxygen. In those cases, there's a lot that you can do. You never need to feel that you're not adding something, because the most important thing for your baby at this stage is to get your colostrum, that nutrient-rich liquid gold, antibodies, immunoglobulins, all those important things. If you can get that to your baby, you are giving your baby the best start in life. And the way to do this is to ask the nurse to bring you a teaspoon. Ask them to show you how to hand express. If you've got time and you're watching this video and thinking, how do I hand express? Go and have a look on the site. There's a wonderful video showing you how to do it. I would encourage you to practice it even beforehand, just once or twice, so that you feel comfortable doing it. If you feel you can't do hand expression, you need to ask the nurse to make sure that colostrum gets to your baby. And if I could just encourage you to know that 1 ml is amazing, 1/2 ml even, is just so wonderful, because it coats the baby's mouth, it sets them for a great start to life. So if you can get just a little bit of colostrum to your baby, that's great. And if the lactation specialist is on board, she can guide you with expressing. So the first day you'll just hand express, even the second day. But if you can start as early as possible with expressing with a good double electric pump and with flanges that fit you and don't hurt you, and flanges are the part that go onto the actual breast, then you are off to a great start. And if you can express for 10 to 15 minutes every 3 hours with a 4 or 5 hour break at night, then you've really, really are helping your baby hugely. There can be no bigger gift than to get your breast milk to your baby. We know that babies in the ICU who are given breast milk tend to have a much shorter stay and come home much quicker. So it is important day 2 or 3 to start expressing. And you will be given lots of conflicting advice on this, because Some of the staff are going to say you don't need to, just rest. But the longer you rest, the less chance of getting things going. The colostrum is always there, but for lactogenesis to take place and for the breast milk to start flowing, you need to start stimulating as a baby would at the breast. The more you take, the more you make. So that is crucial. Your time in hospital should be a positive time, and at no point should you feel in any way that because you're separated you can't go to your baby. Use the time to find out what their policy is and see if you can go in as much as possible and sit next to your baby and hold your baby's hand and let your baby know that you're there. Just because you're separated doesn't mean that you can't be with your baby. Check if your partner can stay and alternate with your partner. No matter what happens in hospital, you are going to have the absolute best start by giving your milk, by spending that time as much as possible being close, and definitely your baby knows who you are. Your baby will know your voice already. If you can record something if you can't get to your baby and ask your partner to take that message in. If you can sing your favorite nursery rhyme. If you've been talking to your baby a lot now, they already know your voice. They already know really even that poem or that song that you've been singing will be familiar to them. So perhaps a way of getting you closer if you can't get to them, if you're attached to all these monitors and you're unwell, is to send a little message on the phone and they can take that, your partner can take that in.